Hello everyone, Dr. Luqman here with Excited Cats, once again bringing you another exciting cat topic. Now today we'll be wrapping up our orphan kitten series with part 5, which is how you would want to wean your orphan kittens. So by this point we hope that any kittens you found have been thriving, have been growing, are really healthy, and it's now time to wean them. So let's look at the weaning process in closer detail. Now before we dive into this is your friendly reminder guys, so please hit that subscribe button, do leave us a like, and a comment, and any questions you have. Let's get into it. Let's go. Now, in nature, mother cats usually tend to wean their kittens when they're around 3 to 4 weeks of age. Interestingly, this is also the age at which kittens start getting their teeth. So that once their teeth erupt, that might be a signal for the mom that, it's time to wean my kittens, because she could be feeling something when they're, nursing on her. On the other hand, mother cats also have a peak in their milk production at around the same time, interestingly enough. So 3 to 4 weeks of age is when the milk production of a queen, which is a female cat with kittens, will actually peak. Now, this is also possibly a trigger for her to begin the weaning process, because she might be thinking, this is the absolute best I can do, and my kittens are not getting enough, so I should, start to introduce foods into their diet. Whatever the case is, we will never truly know, but we can safely assume that 3 to 4 weeks or 4 to 5 weeks is a very good age to begin weaning your kittens. Now, how mother cats actually do this is by initially bringing food to their kittens, in the form of prey or meat or anything scraps that they find, or they bring half-killed prey. Now, this sounds really gruesome, but mother cats actually like to give their kittens practice by bringing in, severely debilitated or injured prey that they catch, and they try to attempt to get their kittens to hunt and practice their skills on, prey. This is actually, an instinctive habit that some cats keep throughout their lives, which is one of the reasons why cats are somewhat notorious for bringing, their humans gifts in the form of prey that they catch outside. But that's a different story. Anyway, how we tend to wean cats is obviously not by using prey, because that would just be, a bit too inconvenient, possibly unethical as well. So what people usually do is they use kitten food. Now, kitten food is actually really nutritious, and the main difference between kitten food and cat food is that kitten food usually has way more calories. It's more calorie dense because kittens have a higher requirement for proteins, fat, etc., because they are growing. Whereas adult cats are no longer growing, so they just need nutrition mostly for maintenance, unless, of course, they are breeding, exercising, working, or doing something that is, demanding on their bodies. So most veterinarians actually recommend using wet kitten food, and they actually do not recommend switching your kitten altogether, because this can be very stressful for kittens in general. So how you would want to start is by perhaps taking 90% of their milk replacer and just about 10% of the wet food that you're gonna, transition them to, and offering that to them once a day, perhaps, in their morning meal, and seeing how your kittens react. Now, if your kittens are okay, you could probably, take note of that and continue with their normal milk replacer in the evening. And after about a period of 2 or 3 days, what you would want to do is perhaps, add the 10% of kitten food on both meals or all 3 meals, depending on how you're feeding your kittens. So morning, afternoon, evening, you could start adding kitten food into their milk replacer, but only a small amount. Continue observing your kittens for a period of about 2 to 3 days every time you do so. And if your kittens seem fine, what you're going to want to do slowly is reduce the amount of milk replacer, but at the same time, increase the amount of kitten food. So you could go from 90-10 to about 80-20, 70-30, 60-40, 50-50, and so on, until there comes a point where the kitten food is actually more than, the milk itself. Now, this entire process should take you around 2 weeks in general. It can take longer, especially if your kittens don't seem to be handling the food too well, or if your kittens don't seem to be thriving on the new food. Now, reasons your kitten could not be handling the new food too well is because weaning in general is a very stressful part for any kitten's life. And many kittens actually develop their first serious medical emergency around this time, unfortunately. It's because they no longer have the attention of their mom, they're growing up, they have to get used to solids, etc. And, the stress is just too much, the body cannot cope, and kittens unfortunately get sick. Another reason your kitten might not be accepting the weaning process that well is because the food that you're offering is just not good enough for them. So we do recommend consulting a veterinarian for an appropriate starter food for kittens. Though there are some companies that do produce, kibbles for kittens. Personally, I do not recommend, kibbles for kittens. The dry matter content is extremely high. Kittens in general are used to milk for the first few weeks of life, so they would do better adjusting to something of a slurry made of wet kitten food and their milk replacer. So you just be mindful that, not all kittens might accept kibbles. That could be another reason why your kitten is rejecting them. And a third reason is because many kittens might have congenital issues that only show up once they're weaning. Now, a very good example of this is sometimes abbreviated as PRAA, persistent right aortic arch, which is basically a condition where the aorta, which is one of the major blood vessels, the way it emerges from the heart is not normal. So because it's going in a different direction, the esophagus is not normal, and kittens will have trouble, accepting solids if this is the case. Now, these kind of conditions obviously require veterinary care, and your veterinarian can, choose the best course of action for you, and, you can proceed with whatever your veterinarian prescribes, because like us, our cats, kittens are also individuals, and they may have individual needs. But if your kittens are hopefully accepting the food just fine, and they seem to be getting along, and they don't seem to be showing any signs of distress as you slowly wean them off their milk and towards kitten food, generally you can continue with the process, and within 2 to 3 weeks, so that means your kittens would be around 7 to approximately 8 weeks old, your kittens would actually be, eating completely solids, or the majority of their food would be solids. Now, please keep in mind that as you transition your kittens from milk to solids, even though you are transitioning them to wet food, you have to be very mindful of their hydration needs. So this is about the same time you would have to make sure that they have access to drinking water, fresh, clean drinking water. Most veterinarians recommend water fountains for kittens now, and even for adult cats actually, because kittens and cats alike seem to be drawn towards a flowing motion of water, and this actually piques their curiosity, and they go to investigate, and they're more likely to drink that way and stay better hydrated. Whereas kittens that are just offered water in a bowl might not be as interested. However, this varies from cats, from kitten to kitten or cat to cat, and there's no guarantee that your cat, will absolutely reject water in a bowl. Some cats are completely fine with that, but it is something, worth trying out. Another thing to be very mindful of is throughout the weaning process, generally towards the end of the weaning process, is when you can consider vaccinations for your kittens. So this is around the time 8 to 9 weeks old, where kittens are usually giving their first, round of vaccines. This is also the perfect time for your veterinarian and you to discuss, your kitten's full vaccination regimen. This one will actually take a few months for the first year of their life. After that, they will get boosters. The frequency of boosters depends on where you live and what boosters your kittens require. In some areas or in some jurisdictions, some vaccines might be required by law. For example, rabies vaccines are considered core in some parts of the world, because rabies is endemic in those parts of the world, whereas in other parts of the world, the rabies vaccine is not considered core, but is something optional that you can use for your kittens. One more thing to be very mindful of is now that your kittens are transitioning from, wet food to solids, you will probably notice that their table manners are not up to par when they initially start. It is very common for kittens when they initially start eating food to actually go inside the food bowl altogether, and they get extremely messy. So you'll find curdling kitten milk mixed with their food stuck all over their muzzle down to their necks and stuff, because they're just so excited to eat. And they don't really fully understand that they can just sit and, eat food. They think they have to be on top of the food. This is just part of the growing process and the learning process. And kittens eventually learn how to, eat properly, and their table manners usually do catch up with those of adult cats. But you might have to be on top of your cleaning game for, a period of the weaning period of a few weeks, and unfortunately for some kittens, this might last as long as 12 weeks of age. Another thing to be very mindful of is your kitten's litter box habits, and this is a very good idea to see that their tummy is okay and adjusting really well to the new food that you're offering them. Now, if your kitten's feces look fine, well-formed solids, and they're defecating about 2 to 3 times a day, they don't seem to be straining while defecating, there's no constipation, there's no diarrhea, there's no bloat, there seems to be no sign of digestive distress, they're still putting on weight, and they're using the litter box just fine. In fact, gaining confidence and independence while using the litter box. This is a very good sign that the weaning process is going over really well and that they're adapting really well to the new food. However, if you do notice signs of like diarrhea, constipation, struggling to use the litter box, straining, using the litter box extremely frequently, for example, 8-9 times a day, but not really producing much as far as waste goes, appearing very bloated or appearing very lethargic in general, not showing an interest in playing with their litter mates or with you or their toys, this is a sign that you have to see your veterinarian because the process might not be going as smoothly as you anticipated. An interesting point that some people like to ask me is sometimes when they have a mother cat taking care of a kitten or kittens, and she refuses to wean her kittens, what should they do? Should they actually intervene? Now, obviously, this will not happen to you if you have, rescued an orphan kitten. But again, if you have rescued an orphan kitten who you found a stepmom for or a foster mom for, and she's refusing to wean her kittens, like she still gives them milk, her own milk, and she is teaching them, the cat ways, and they are eating solids, but the mom is not actually stopping the process of breastfeeding the kittens. What should you do? Now, generally, veterinarians will leave this be until the kittens are about 8 to 9 weeks of old before they try separating mom from kittens. And if they do separate the mom from the kittens, they don't do it abruptly, and they do not advise doing it abruptly. In other words, they'll probably just separate the mom for a period of about 6 hours to give her a break away from the kittens. And after 6 hours, they'll let her go, and they will let her breastfeed if she wants to. If not, that's fine too, because a kitten that is 8 or 9 weeks old is obviously well developed enough to be weaned on solids, and it shouldn't be life-threatening that they're deprived of mom's milk for 6 or 8 hours. Anyway, this process is basically similar to the weaning process of where you mix food and stuff, except this time you're going to isolate the mom and the kittens. Now, interestingly, there are studies that show that moms who keep their kittens near them for a very long time, around 8 weeks, 9 weeks onwards, those kittens or those cats, when they grow up, actually have lower incidences of feline obesity. Now, the reason why is not completely understood, but that could be one reason why instinctively some mother cats refuse to wean their kittens so quickly. It is really interesting and fascinating, but again, something you wouldn't really have to worry a lot about if you're fostering for an orphan kitten, but something to keep in mind if you do have a foster mom. The most important thing is do not stop, do not limit the mom's access to her kittens abruptly. For example, do not go cold turkey, because then the mom might actually develop a condition known as mastitis, which is basically an inflammation of the mammary glands. Because the mammary glands are full of milk and there's an abrupt stop in, the demand, this can actually be very painful and requires medical attention. So as always, anything with weaning, with regards to weaning a mom off her kittens or weaning kittens off their milk replace or anything, the take-home message is to always go slow and, keep it slow. It might seem really stressful to go super slow, but it's always worth it in the end, because you can always avert disaster or unfortunate circumstances if you're just patient with it. So patience is definitely key here, guys. So that's it for our kitten series, guys. I do hope you really enjoyed our orphan kitten series. If you would like us to talk about another series that you're interested about with regards to your cats, do let us know. As always, this is your friendly reminder. Please hit the subscribe button. Do leave us a like and a comment, question, or query. For now, this is Dr. Luqman signing off. Bye, guys.